discussions. Just a sec. Lighting's kind of bad, but so the other day I was talking about disc herniations in the lumbar spine, and I just want to talk about this a little bit more in regards to after accidents. It's primarily what I deal with. So when we have people that come in and have imaging done, because we'd send out a lot of MRIs due to legal reasons, and we get all these reports back, and a lot of times they have disc herniations on them. And the tricky part with clinical work in this case is you have no idea how long it's been there. You can guess by age, it's probably been there for a while. You have people show up in their late 30s, 40s, 50s, and there's some disc herniation on the lumbar MRI. The likelihood of it having been there prior to the accident is very high. And the difficult thing is you almost never have some sort of prior imaging to refer to when these people come to you. So you're just you're just reading the report to the patient saying, these disc herniations are evident after the accident in the lumbar spine. We can't say for sure if they are new or if they were there prior to the accident, given your age, occupation, things like that, history, if you've had your back pain in the past. The likelihood of these being there beforehand is pretty high, but for one reason or another, they're been irritated by the violence, velocity of the accident. So just making sure you set that stage in the beginning with the person that they probably had these before. They are reporting to me that before the accident, they were not suffering from low back pain. These herniations are on the MRI after the accident. They're probably there before the accident. So we always have to help them keep that into context and, help them understand disc herniations, disc bulges are common. They're normal. They don't necessarily lead to pain. Some people that have them have pain, depending on location, severity, acuteness, things like that. But we could MRI thousands of people and see lots of disc bulges and disc herniations and have a very broad range of people's pain experiences. So one of the best ways to frame it to help the patient understand the context and to get through the situation so that they're not someone who may end up feeling like they should have continued chronic pain and forever almost, which we hear people say that sometimes after an accident, is to help them realize, hey, these disc herniations are common. You probably had them before the accident. They're sensitive and irritated after the accident. Hello. And since you weren't complaining of back pain, you're telling me that you did not have back pain complaints prior to the accident, even though you likely had some sort of disc bulge herniation before. We have to remember that you're probably going to end up recovering fine and be symptom-free in the future. The timeline may be pretty long because you don't have a lot of direct blood supply and turnover and things like that. Cell turnover happens very slowly in that area. So, you being symptom-free from the disc injuries will take longer than basic sprain strain, but that sensitivity is going to reduce. We're going to stay as conservative as we possibly can. And the goal is to have you feeling good in the next month or two. So just making sure that they understand it was there before. It's going to be there afterwards. The body heals. The body will always trend towards healing. And don't get too worried. Don't get too stuck on the fact that there's this disc bulge or herniation. You're going to feel better, and Just make sure that you're setting that patient up for success and you don't leave them thinking that this is something that's going to continue to bother them forever. So, context, how you phrase things, and patient communication, trumps a lot of things when you're looking for good outcomes. All right. See you guys later.